The Skills Lab was really a great thing for us because we were really able to evaluate our entire department and really see where all our staff were with regards to hourly rounding. A lot of staff had a lot of aha moments as we explained the why behind hourly rounding and give them constructive criticism. It was a very structured environment. We kept it positive, and we put it in their hands. What did you think you did well? What are your opportunities? And that's the way we really was able to present it to them.
I think the Skills Lab has been pretty productive. It's made us really focus in on what our patients' needs are.
The Skills Lab opportunity is different from a formalized classroom setting is that it allows the nurse the opportunity to learn in an environment that is truly identical to the situations that they will be walking into on a daily basis. The fact that the room is set up in a way that they might see someone and their environment helps them to understand all of the nuances that go along with hourly rounding and the things that they need to assess as they're moving through the patient's day.
Okay, so here's your call light. I'm going to get your phone close where you can get it here. And we'll get your table back to you. And you just call me if you need anything. I'll be back later.
Great, Eric. Come on back. First, I just want to start by saying thank you for taking the time to participate in this individualized one-on-one learning lab. It provides the opportunity for you to get specific feedback on your skill set and also gives you the opportunity to ask any questions that you may have related to the hourly rounding skill set. So how do you think you did? Fair, good, or excellent?
I think I did good.
I think you did good too. You did a great job at being able to assess the room and looking for those things that put the patient at risk. You picked up things off the floor, you got my overbed table closer to me, you got my bedside table close to me with my phone, and you made sure that I had my call light with me. So I think that was very well done.
And also, Eric, in order to reduce your patient's anxiety related to the public perception of hospital cleanliness, it's important that you validate that your patients feel clean and safe by using those keywords at key times, clean and safe, during the hourly round. This audible assessment will help alleviate your patient's anxiety, improve their clinical outcomes, and their overall experience.
Let's focus on how you left the room. You stated as you were leaving, call me for anything. You didn't give a specific time frame when you would be returning, and you didn't use the keywords at key times, urgent and emergent needs. How do you think that this behavior impacts your ability to be able to manage your day effectively?
Well, I think I do pretty good with managing my time, and I really do think that my patients need to be able to call me for anything they need. I don't want them to have to wait until I come back in an hour to get them what they need. They should be able to call me for anything whenever they want me.
Well, actually, Eric, hourly rounding is evidence-based, and it has proven that it leads to better patient outcomes, fewer falls, less pressure ulcers, better responsiveness by the staff, and actually better pain management. It really helps you to establish that trusting relationship with the patient.
You're also going to get some more uninterrupted time back at the end of the day, which allows you to focus on nursing necessities, such as your documentation. The things that can help you or some tactics that I suggest to use are finger counting. What this does is it focuses on the patient to let them know that they need to be thinking about the things that they need from you, as well as pointing to the clock to be able to cue them into the time-sensitive nature of those things. Try this. Patient, it's 1:30 right now. I'm going to be back between 2:45 and 3 o'clock to take care of your general needs. But if you need me in between time, I do want you to call me for urgent and emergent needs. And let me tell you what they are. Being able to define these needs for the patient helps them know what is okay for them to call you for when you're not there and what you might be able to take care of while you're in the room.
Okay, I guess that kind of makes sense. So I take care of everything while I'm in here, and then I end up gaining time back by not getting calls all day long.
That's correct. I also want to suggest that you pay very close attention to your nonverbal communications. As you were leaving the room at the end of the skills lab, you seemed very hurried or rushed, and that you were almost in the other patient's room before you left me. So don't let your task doing impact your engagement with the patient, even at the end of your time together.
Okay, that makes sense. So I guess you're saying I need to stay more engaged the entire time I'm in the room and not be focused on what I'm about to do in the next room.
Absolutely. So what are you going to take from this skills lab today out to your practice on the floor as you take care of patients using hourly rounding?
Well, I think by doing the couple things that we talked about and improving my hourly rounding skills, I'll be able to better anticipate what my patients need while I'm in the room, and they won't have to call so frequently, so I'll get time back throughout my day.
Great.
And what are you going to share with your peers out on the unit about hourly rounding?
Probably that everybody needs to be on the same page so that our patients know what to expect and they feel safe and secure in their care.
Some of the results that I have seen from the Hourly Rounding Skills Lab is an increased understanding of the primary nurse to utilize communication as a way to effectively manage time, meet the patient's needs, as well as find any opportunity they can to provide more exceptional care for the patient.
My job goes a lot smoother. I feel comfortable because I can go into a patient's room and I have a kind of a checklist that I run through with them, and every time I go in there it gets a little bit easier because I kind of define an objective that I have every time I go in there and a role that I play in their care.
I have more time to work with the patients. You don't get a lot of interruptions, patients calling now and then, because now you've already anticipated their needs ahead of time.
I'm able to go in, ask the patients if there's anything that I can do for them, as such, your 3 Ps, pain, party, and positioning, get those needs taken care of so I don't have to go back for another hour.
You get to ask them about their pain and their positioning, but of course to make sure that there are no other underlying things that you can take care of while you're there.
They realize that they are being taken care of. They know when you're coming in. They know what to expect when you come in, because you're telling them, I'm going to be doing this for you, and this for you, and if I can help you to the bathroom or take care of any pain medication needs at this time, we can go ahead and get that taken care of.
I feel that I've had a lot more time to focus on their personal needs and also getting my charting done in a more thorough manner.
I really have noticed a decrease in the extracurricular call lights that we've received, as well as an increase in how happy my patients have been and how well my time has additionally been managed, how much more time I've had at the end of the day to take care of all the additional things that I would love to take care of for my patients.
Very rarely do I have any of them even use the call light. It cuts down on the noise on the floor tremendously. They know where I'm at, when I'm going to be in there.
Well, when you are able to go into the room and use the emphasizing keywords at key times and really try to pay attention to all of those needs right then and there while you're in the room, and maybe as you're on your way out, say, please do call me for those urgent and emergent needs. They at that point realize that they should partake in your presence while you're there.
The more I go in there, the more we both understand what we're doing for each other and what they need to ask me for and what they should ask me for.
And thus really just increasing the patient satisfaction and decreasing our workload.
They feel more secure.
I think that brings a lot of peace to families who are in the room.
You're comforting. You're going in, you're talking to them, so you're giving them some other kind of stimulation and some other kind of therapeutic way of controlling pain.
When I'm around with the patients are saying that the staff are more attentive, more responsive, appear to be more professional, and a lot of patients are like, something has changed, but I can't put my finger on what it is. And I attribute that to the Skills Lab. I think the Skills Lab was able to bring everything together and just help the staff understand why hourly rounding is so important.